Hi, my name is Kim Harrison, and I'm a healthcare assistant with LAUSD, and I provide service to medically challenged students along with being a special ed assistant. And I've been doing this for 27 years.
My name is Hennessy Valenzuela, and my daughter is Alize Garcia, and she's a student for LAUSD. So Alize has been with Miss Kim since middle school. Alize started middle school in 7th grade, and now she's in high school and she's in her 9th grade, so it's been 3 years already.
A typical day for me, I wake up and I get ready for work and start, and I meet the bus. I ride the bus with my student, and I park my car there. And so as soon as we get there to the school, I go and change her, and then we go to different classes because she's a high schooler. And my job description, I do medical parts like giving meds, doing protocols such as tube feeding, and then also helping with the other students in the class.
So Alize has severe cerebral palsy. During delivery, she had a brain injury worldwide, so it led to cerebral palsy. So she is in a wheelchair. She depends on me. At school, she depends on Miss Kim.
Along with all the protocols with some healthcare assistants have more than one protocol. My particular student has a 9 o'clock, 11 o'clock, a 12:30, a 1 o'clock, and 2:30 protocols, and then in between then I have to change her, and we go to PE, so I help her in PE, and then when I'm not working with her, I'm working with other students in the class.
Alize tends to sleep a lot at school, so I think that when Miss Kim is around, she's a familiar face, she's somebody she knows, so she feels comfortable, and she's more alert, more awake when she's around because she already knows who Miss Kim is. The way Alize expresses herself, she's either mad, she cries, but she's very comfortable around Miss Kim. She's happy. She actually gets upset when Miss Kim doesn't go to school. So you could tell she misses her. You could see her change of character, how she comes home and she's not as happy. And when Miss Kim comes back, how she's upset at her. So she definitely misses her when she's not around.
They do need consistency as far as healthcare assistants, because they get used to that one person, and you develop a bond no matter how. Like, I remember when I first started, the district would say, "Oh, don't get too close," and I'm like, how do you not do that when you're working with someone every day? You know their needs, you know their cries if they're nonverbal, you know what bothers them if they make certain noises, or they're sick or not feeling good or happy, so you just learn their language, basically. And so when someone new comes in or have to fill those shoes, they don't know the student like that. So it does make a big difference.
Miss Kim is amazing. She's my second pair of eyes at school. She lets me know when Alize has any problem, she's not feeling well. I know that at school, she's the one that does everything I would basically do at home, which is change her diapers, change her clothing if she needs a change of clothes, feed her, administrate her medications. So Miss Kim is like another mom. What
I love most about my job is the smile, putting a smile on the kids' faces, or high-fiving, or being active. We just recently participated in a special arts festival downtown, and doing the dance with the kids. They were so excited, and being able to see them actually do things and participate and see the adults doing it, that's what makes me stay, because I really, really enjoy my job.
Each kid has different medical conditions, different needs. So I think it's very important that there's Miss Kim for Alize or other healthcare assistants for other children, because if not, the teacher would just go kind of crazy with different situations. The medication, who would administrate medication. And if Miss Kim wasn't around, or another healthcare worker, would I even be able to send my daughter to school?